Did you know Black women are 40% more likely to die from breast cancer? It stems from late-stage diagnoses, lack of access, and screenings and systemic inequities. So we're welcoming local expert Tamia Booker and breast cancer survivor Thandi Montgomery to discuss new information and a free webinar available next week on breast cancer and women of color. Tamia and Thandi, thank you so much for joining us.
Thank you for having me.
us.
Let's start a little bit with why there are these disparities that really make an impact in women of color.
Yeah, I would say, Victoria, every woman deserves the right, every man as well, to survive regardless of their age, their race, or their socioeconomic status. And when I was first diagnosed with breast cancer, I realized that breast cancer is not biased, but there still are parts of the healthcare system that are. And so when you think about the data is disturbing. So 40% of Black women have a higher mortality rate. 1 in 8 women will be diagnosed with breast cancer. And then there's also misrepresentation when it comes to clinical trials. There's less than 3% of Black women who participate in clinical trials.
And why does that matter if Black women are in these clinical trials to maybe for new either medications or new ways to combat breast cancer? Why is that important?
It's important because we need to be able to be part of the process to figure out ways, like you said, with medication. When I worked at the Department of Health and Human Services, this was an issue back then. And when Thandi and I were talking, we were talking about how it's still a problem that we're not part of these trials while we're being impacted at high rates of getting cancer. So there's a lot of stigma in the Black community between the Tuskegee experiment, what happened with Henrietta Lacks. But unfortunately, we're at a place now where we need to destigmatize it because what's happening is without us being able to participate, it is actually to our detriment.
Mm-hmm. Thandi, talk a little bit about your diagnosis. When did you get it and at what stage were you diagnosed?
Yes, absolutely. So I was 38 years old when I was diagnosed with breast cancer. It was 2021. And they always say that you never forget the day you were diagnosed, just like you don't forget the day you were born. So it was November 1st, and I was stage 1. I actually found my cancer myself. I had my well woman's checkup 2 months prior. Nothing was there. And so I always do my monthly self-exam. And so I found something that was foreign in my body. I was on vacation, and it was about the size of a pea. And I wanted to ignore the warning signs, but I went ahead and scheduled an appointment with my PCP. And shortly after, I had a mammogram, an ultrasound, and a biopsy. And then that's when they found out that I had invasive ductal carcinoma, stage 1.
Oh my goodness, I couldn't imagine getting that type of information at 38 years old. Tamia, talk about the webinar and how people can participate.
Yes, absolutely. So really what we like to do, I do a lot of work on policy. And so I really wanted to merge the two worlds of having policy and also a survivor who is out here advocating. What we're going to talk about on the webinar is Thandi's story and how her story reflects many others and why it's important for us to advocate for more preventive measures for women of color and raise awareness. So if people are looking for more information to join us, we'll also be joined by breast cancer oncologist Dr. Monique Gary, and it'll be next Wednesday at noon Eastern Time, and you can find information on our website at tbookerstrategies.com.
And of course, we're going to have all that information on WJLA.com. Tamia and Thandi, thank you so much for joining us on 7 News at Noon.
Thank you for having us.